Hello, my name is Cindy Nyquist. I am the founder and president of Upper Peninsula Home Health, Hospice, and Private Duty. And it is my honor today to welcome each of you as part of our team. We're looking forward to you through this journey of orientation and inclusion in our family. During your orientation with us, you're going to be meeting many people, and we're all part of a big puzzle. And one of the things I like to be able to tell each of our new staff that are joining us is how important that puzzle really is, and that each and every one of you are one piece of that puzzle. It doesn't matter what piece you are. There's no one piece that is more important or less important than any other piece, but it takes every single piece to make the perfect picture of our program and our services to the community. So as you join our family, remember there's no one more important than you, and there's no one less important than you. There may be lines of authority that we all have to maintain to have an organization that runs smoothly, but it doesn't mean that anybody is more important or less important. My piece of this orientation is really to tell you about a little bit about our history, so you know what type of organization you're coming into, why we're here, where did we start. Every one of us have a story. You have your own story. Jeff Nyquist, our executive director, has a story. I have my story, and I'd like to share some of that with you. It planted seeds, and it planted the seeds of hospice. When I was 4 years old, my mother, who was only 30 years old, keep that in mind, only 30 years old, and she died of breast cancer. That was around 1951. And at that time, we as a nation and as a country, how we cared for people with life-limiting diagnoses is we put them into institutions. There was nothing wrong with that. That's what we did. We thought that hospitals were the thing. It was the best thing for all of us. We didn't always understand the consequences. So what happened to our family was part of what planted the seed for finding a better way to care for patients and their families with life-limiting diagnoses. So my mother was put into a hospital. My father was working for the railroad, and so he was sometimes not always here. He'd be out of town for 5-6 days at a time. He had 3 children, a 7-year-old, a 4-year-old, and an 18-month-old. And his wife was, quite honestly, dying. And that's the only word I could use at this point, because you're going to hear me talk about how hospice is not about dying. But our mother was in the hospital at the old St. Luke's here in Marquette, dying by herself. And at that time, her pain was so bad, they didn't treat it. They were afraid that somebody might get addicted by pain medications. Somebody who's dying might get addicted. And her screams were so bad. And I know this from the nurses who took care of her that I've met over the years. She was isolated in a room behind the laundry rooms so that the rest of the patients did not have to deal with it. Our mother was taken from our home and put in that institution. There was really no interaction. So, as children, we didn't know where our mother went. Our mother was there one day and she was gone the next. Imagine what that does to a family. Part of what we found out afterwards, and this is why the seed was planted with me, is I saw the dysfunctionalness that occurred. Now, as a 4-year-old, did I understand things? Absolutely not. But I'm going to jump ahead a few years. My father remarried, and there were 3 more children with that marriage. So now there was a household of 6 children. When I was 19 years old, and my stepmother was only 38 years old, she died of esophageal cancer. Where was she again? She was at St. Luke's Hospital, isolated alone in her room. None of my siblings were allowed to come and visit her because they weren't allowed in the hospital. Young children were not allowed in the hospital. My father and I took turns sitting with her. And my father worked, I was going to school, I was married, and my father worked during the day. He had to work. He still had children that he had to take care of and have an income. So I took the night shift, and it was many night shifts, but I can remember the last night shift. At 6 a.m. the nurses came in and they asked me to leave. This was normal. This was not anything unusual. It was not inappropriate. They asked me to leave because they had things they needed to do. They were doing their job. So at about 7:20 we got a phone call. My mother had died. Nobody was there with her because we were doing things the way everybody was doing things. Obviously the seed was planted even deeper, that there has to be a better way for us to be able to take care of families that have life-limiting diagnosis. Now I'm going to jump backwards and forward a little bit at the same time. I told you we had a family of 6, and I saw the dysfunctionalness. After my second mother, my stepmother, died, there were still children at home. I had an older brother who was actually in Vietnam at the time. I had 3 younger brothers and a younger sister. Within a year, my other younger brother, because he was just turning 18, was drafted. He did not have an opportunity to see his mother. Dysfunctionalness is what I'm talking about. And he was drafted. He went to basic training, and he was being shipped off to Vietnam. He chose instead to commit suicide in our home, off of his bedroom, on a porch, rather than going. Now, that could be said, there's many things there. I've always looked at it, it was a lot of the dysfunctionalness that took place because of not talking with families, helping them grieve, helping them process the loss that they're going through. My other 2 younger brothers both basically dropped out of school, got in trouble. They were both in jail at least once. Fortunately today they are fabulous business people, family members with children, and they're just doing wonderfully. But that's only been after many years of trying to work through many problems. But I think the story that hits me the most is my 7-year-old brother from my first mother. It was only about 25 years ago that he opened up to me. He's now 67, 68. So it's only been that long ago. And he always thought that he had done something wrong to cause our mother to go, that 7-year-old boy. And at age 12, he was still feeling that, and he had throughout most of his life. But at age 12, he was working as a caddy at the Market County Golf Course. He got exposed to alcohol. He became a lifelong alcoholic because that alcohol eased his pain for what had he done to cause his mother to disappear at age 7. Those are the things that truly happen. They're real stories. And it's not just my story there. These happen in far too many homes. And that's where I was determined. I did not want other families to go through the turmoil that I saw our family go through. I was fortunate. I mean, what is the genetic makeup? I don't know. I was just determined that I was going to make this better. I wasn't going to go out and have a drink. It just never was a thought in my mind. It wasn't what I needed. I needed to make a change. And I was in nursing school at Northern. But let me tell you a little side note on that. That was kind of cute, actually. I had decided I wanted to become a nurse. This is in the 60s. And there was St. Luke's School of Nursing. It was part of what Market General is right now. And so I went there to apply to become a nurse. And I was flatly turned down. And you know why I was turned down? Because I was married and I had a child. And I was told, your place is at home to raise your child. You should go home and be a wife and raise your child. Well, I have to tell you, I could use a lot of words right now. That did not make me very happy. Fortunately, at the same time, a new BSN program, a bachelor's program, was starting at Northern. So I basically walked across the street and they welcomed me with open arms. So I started my career to become a nurse. But I also did a lot of complaining to my mother's doctor, the original Dr. Huffman, and to my instructors at Northern. Why aren't we taking better care of patients and families who have terminal diagnoses? Why? Why isn't there a better way? Well, they started challenging me. Well, what are you going to do about it, Cindy? Here's an opportunity. Well, you know, I'm just a kid myself. What am I going to do about it? Well, at least they led me in some directions. They said, well, start doing some research. Do an independent study. Go do some research. We didn't have cell phones. We didn't have emails. At that point, we only still had letter writing through the mail. That was it, guys. And we managed with that, believe it or not. But I started doing research, and I came across this word, hospice. I didn't know what it was. I mean, no one did. None of us. We did. Well, the more I read about it, and this hospice was in England, and there was a woman there by the name of Cicely Saunders. She began as a social worker, and then she became a physician over time, and eventually she was actually received the title from the English royalty of Dame. So she was Dame Cicely Saunders. But as I was reading about what she was doing in the 30s, she was caring for people with life-limiting diagnoses. So the more I read, I thought, So I wrote to her, and I told her what I was thinking, and if she could give me any other guidance or ideas. She invited me to come to England. There was no way I could go. That was far out of my reach to ever consider. It would have been a wonderful thing. She actually was coming to do some type of education out on the East Coast, and she invited me to come there. But again, that was just outside of my means, quite honestly. And I've regretted that to this day. Why didn't I find a way? But I'm just being, reminiscing. But we did correspond back and forth, maybe a half a dozen letters total. And she was an inspiration to me. What she had done, and that I could do it. Well, I think I was young and naive enough to think, okay, we're going to do something here. But Margaret Reddig, Kit Casey, Lou Irvast, unfortunately none of them are with us any longer, but they were an inspiration in my life that kept me moving. But they also had a small little nursing organization that they allowed me to, for lack of a better word, start practicing my hospice philosophy. And we started providing care back in 1973. We began all of this in the late 60s, but by 1973 it was philosophical care. It was starting to work with the doctors. When Dr. Sholnick and Dr. Arnold, their names you may not know, but they were the forefounders of our hematology oncology programs here in Marquette. And we got them involved. And in the early days, when I first started going out, I was naive enough to think that I could go out and talk to people, that today I'm wondering if I would have really still had the nerve. But I went to the bishop of the Catholic diocese. I went to the president of the university. I just kind of acted, well, you know, you got to know about hospice. And these people actually started getting involved. And back then, in the early 70s, if you asked anybody what hospice was, they would look at you and say, oh, you mean hospital? They had no idea what hospice was or what it involved. The doctors didn't. So it took decades of educating physicians and getting them involved with this process and embracing that philosophy of palliative care. So as time went on, we then added also private duty to our program. And that we did, again, because of a need in the community. And how we started private duty is that many people would not qualify because you have to have skilled needs to be in home health or hospice. But people would fall through the cracks and they had some needs. So we developed a private duty, and we developed it so that it only breaks even. And so we maintain the cost of it at the lowest possible so that people could get help with maybe going to the grocery store, cleaning their home, to help them to stay within their own home. And that's what our private duty is about. And we do have resources that if somebody is just totally destitute, we can either donate those services to them or find other sources to help pay for them. But within our home health and our hospice, we have never billed a patient, and we will never bill a patient. If you have those needs, you will get them from our organization, period. Obviously, we've come a long way in the last 40 plus years, and it went far beyond me. It has included so many people who have believed in this journey. They have believed in this mission and vocation. This has never been a job for me. This has never been a business. It is truly a mission-driven vocation that fortunately many people have also embraced, up to and including who you have met, Jeff Nyquist, Dr. Nyquist, who I'm very proud of as my son, who has taken over the reins of the organization. And he'll be talking to you more as time goes on as well. But Jeff grew up during all of this time with me and has definitely embraced, and it's within his soul. And to me, it's so rewarding to see not only him, but the hundreds of other people who have embraced this mission and is making sure that it continues on. And that's what we're excited about, each and every one of you, how you're going to be joining in this long-term journey and mission and vocation. Another person that I know you'll be hearing from at least a little bit is my daughter, who's also very involved. She's been involved for many years, and she does it all behind the scenes. She is a CPA. Her background is accounting. But you have to have somebody smart enough to make sure that we do things well financially, so that we can make sure that we are giving each of you everything you deserve and more, but we're doing it correctly and with a very fiscally sound approach. So you'll probably be hearing and seeing from Debbie Nyquist Arrow, A-R-O. As I'm welcoming you, I also want to let you know a piece of information that we're very proud of. Our hospice program, Upper Peninsula Hospice, was actually the very first hospice program in the state of Michigan, and it was one of the first 3 in the country back in 1973. We're very proud of that. When we started hospice in Marquette, it was the first, but before long there were other people that were expressing interest across the Upper Peninsula, and I had the opportunity to work with many of them. And they all started developing their own hospice programs across the UP, to the point that within the Upper Peninsula of Michigan, we had more hospices per capita than any other place in the United States. And we have been able to designate the Upper Peninsula as the cradle of the hospice movement in the U.S. because of that. too often, as it's not only with the physician, it's the education of our community. And each one of you who are coming within our family will have the opportunity. Talk to as many people as you can. Help them understand what hospice is all about. Now, I'm only talking about hospice. We have a home health program that is fabulous too. But I started with the roots with hospice, so that's where I'm going to come from. But each of you will become an ambassador. Each of you are joining such a fantastic organization of people that I'm impressed with every day. What our staff is able to accomplish is phenomenal. And you now are going to become a part of that. We like to use the word PEP. Hospice care is about living, and it's also about PEP. Capital P, capital E, capital P. First P is palliation, palliative care. Second E is about empowerment. Empowering a family to take control of their own destiny to the level that they possibly can. And the other, capital P, is about setting priorities, their own priorities. And it is our team. We don't come in and take over. We are there to support and enhance a family, but we are not there to take over a family. But if you can always remember, whenever you have an opportunity to talk about hospice, remember it's about living and it's about PEP. Now it's time to transition, and I've been slowly transitioning. I mentioned my children, and they're only two pieces of the puzzle. Don't forget that. I believe next in your orientation is going to be Dr. Jeffrey Nyquist, the Executive Director and CEO of Upper Peninsula Home Health, Hospice, and Private Duty.